Stepping up action on childhood obesity, building a youth-led response. The World Health Organization has identified childhood obesity as one of the most serious public health challenges of the 21st century. The prevalence of childhood obesity has been consistently rising over the past decades, with numbers nearly doubling every 10 years and showing no signs of slowing down. It is therefore clear that current interventions aren't working and new, bold, innovative actions are needed urgently. But first, what is obesity? Obesity is a chronic disease that independently contributes to poor health outcomes and mortality, but also increases the risk for other chronic diseases such as cardiovascular diseases, diabetes, and some forms of cancer. Evidence shows that childhood obesity can impact a person's mental health and lead to lower levels of self-esteem and higher likelihood of being bullied, has psychological impacts, including poor body image, anxiety, stress, and depression, has psychosocial consequences, and can lead to the perpetuation of weight stigma, which is the negative behaviors and attitudes that are directed towards individuals only because of their weight, and can impact a child's educational situation with poorer school attendance levels and poorer school achievement. To respond to the rising rates of childhood obesity globally, the WHO Commission on Ending Childhood Obesity has published a comprehensive framework for action in its report, Ending Childhood Obesity, also known as ECHO. ECHO has two overarching goals. The first one is to prevent children and adolescents from developing obesity. The second one is to treat pre-existing obesity in children and adolescents. The framework is then structured around 6 key areas of action. Promote intake of healthy foods, promote physical activity, preconception and pregnancy care, early childhood diet and physical activity, health, nutrition, and physical activity for school-aged children, and weight management. In October 2020, World Obesity held a series of meetings with key obesity stakeholders, which led to the identification of several cross-cutting challenges and enablers to the implementation of childhood obesity policies and interventions. This helped develop a set of recommendations to improve the global response to childhood obesity and improve policy implementation. The recommendations were as follows. Establish a monitoring and accountability framework with SMART targets. Such a framework will allow you to identify if your work is on track according to your objectives and timeline. It will also help hold different stakeholders accountable towards specific objectives. Take a life course approach and ensure interventions are available for all the key life stages. The drivers of obesity change throughout the life, which is why we need to adopt a holistic approach to health. Ensure strong governance mechanisms and political leadership are in place. Adopt a whole-of-government, cross-departmental approach to actions on obesity. This will ensure child health is prioritized across governments and reduce the prevalence of NCD and associated poor population outcomes. Increase investment in obesity prevention and treatment as a cost-effective strategy. Incorporate the rights of children with obesity within human rights legislation, healthcare, and education systems. Ensure that legislative tools are used effectively to eliminate the pervasive and unacceptable stigma, discrimination, and bullying. Policies and interventions to address childhood obesity need to be coherent and comprehensive and include all environments. This includes education, health, food, social protection, and water and sanitation systems. Ensure national plans include actions that address the inequalities and stigma faced by children living with obesity, for instance in schools, healthcare settings, and local communities. And finally, counter racism, social inequality, and the barriers to social determinants. Guidelines should go beyond the formal health sector and focus on promoting supportive environments for all.